This is chapter 42, the integumentary system. So, the skin is the body's main protective system, and so it has various functions. It consists of several layers. You have your the epidermis, which is the outer layer that's made up of epithelial cells. It protects the body and the internal structures from harm by providing a barrier to the external environment. So that's your outer layer. Right under the epidermis is the dermis, which is the middle layer of the skin. And then deeper, you have the subcutaneous tissue, which is under the dermis. And then other parts of the integumentary system include the hair, the nails, and the glands as well. So when we talk about glands, you have sweat glands, oil glands, things like that. So like I said, the skin itself has several functions. It serves as sensitivity to pressure, pain, touch, and temperature. It's the first line of defense against infectious organisms. It provides thermal regulation by sweating, helps to regulate the temperature. So when you sweat, it helps to cool you down. Shivering helps to produce heat. And subcutaneous isolation as well to help with warmth. It protects the underlying tissues and organs from injury. It synthesizes vitamin D. It excretes water, salt, and electrolytes. And it also regenerates itself by shedding old cells and replacing it with new ones. And this is just continuing to go into more of the functions that I've already described. Like I said before, it helps to synthesize, the skin helps to synthesize vitamin D. And it protects, protects the body or the tissues from ultraviolet lights. It has transmits heat, cold, pain, touch, pressure, all those type things as well, like we said. The hair follicles are comprised or composed of primarily dead cells, and they pad the scalp and protects from external objects. And it also helps to maintain the body's temperature. The nail beds are also made up of dead cells as well, and they, obviously help to protect the nail beds. You have sebaceous glands. The sebaceous oil glands are located throughout the body, and they secrete sebum to lubricate the skin. It lubricates the skin, but it also decreases water loss, which helps with killing bacteria on the skin surface as well. So you have sweat glands in several places. You have sweat glands in the axilla, which of course we know is under the arms. You have sweat glands in the anus. You have sweat glands in the genital area. You have sweat glands on the forehead, your hands, the soles of your feet. And so those sweat glands help to maintain stable body temperature by perspiring when the body gets overheated. So it helps to cool you down. Like I said, also the hair helps to retain heat. And then the nails, cover the nail beds of the fingers and the toes. So when we talk about our aging population, A lot of different things happen to the skin as we age. The elastic fibers decrease. The adipose tissue, which is, remember I said the fat tissue, that decreases. Um, and so that causes the skin to, you might see some individuals, their skin is wrinkly or sagging, and that's because of that decrease in the elastic fibers and the adipose tissue. Um, there's a loss of collagen fibers in the dermis. Remember we said the dermis was the second layer, and so there's a loss of collagen fibers, and that causes the skin to be more fragile. And if you do have a wound or something in the skin of our older populations, it might take a little bit longer to heal because the skin is so much more fragile and you don't have that collagen fiber to help with the healing process. The skin becomes thinner and more transparent, so that's why they're also at a higher risk of skin tears and things like that, which we'll talk about as well. But so they're at a higher risk for skin tears because their skin is so much thinner. They have decreased sebaceous glands, and remember we said our sebaceous glands were oil glands that were, and they help to lubricate the skin. So if you have a decrease in the sebaceous glands, then the skin's going to be more dry. If it's more dry, it's going to be itchy, right? Decreased temperature control. And so they have an intolerance to heat. If you've ever been around any older person or elderly person, you might be in the room and they have the heat on 80 or 90 degrees and got a sweater on, and you're in there burning up like, aren't you hot? But you know, that's because they, you know, as they get older, they have, you know, more of an intolerance to the cold, and so they, you know, like it a little bit warmer in the environment. A few other things that happen with our aging population as it relates to the skin. You probably notice a lot of older people, maybe their hair starts to get thinner, or you know, the rate at which their hair grows decreases. They gradual loss of hair color, so then you know you start to see the graying, the hair becoming gray. Ridges in the nail beds, or the nail beds start to thicken. You know, these are just some other things you might notice. Age spots you might notice as well in the aging population. So we're going to talk about a lot of different disorders or diseases of the integumentary system, but a lot of different reasons, as you'll see when we talk about some of these different diseases. You know, different things can cause different integumentary disorders. It could be an endocrine issue, it could be a metabolic issue, it could be an inflammatory issue, chemical burns. We'll talk about, you know, burns and physical issues. A lot of different things can cause you know, some skin disorders, and we're going to talk about, you know, several of those different orders as well in the next chapter. So to prevent various skin disorders, um, you know, you want to make sure you teaching your patients to um, clean their skin with soap and water and dry it appropriately. Don't leave the skin moist after cleaning. When, as the nurse, you know, when you're assessing the skin, um, keep in mind that skin disorders may involve or stem from various disorders that might originate in other body symptoms, other body systems. So during your assessment, you want to be sure you investigate even minor symptoms or systematic complaints as well. You want to prevent the skin from drying out. It dries out, gets irritated, things like that, you know, can lead to, you know, other issues. Making sure you teach your patient to have a well-balanced diet as well. Having a well-balanced diet means there's no nutritional deficiencies. Nutritional deficiencies can lead to skin breakdown, you know, as we'll, you know, talk about Do they have enough protein in their diet? Different vitamins and things like that. Having adequate fluid intake. You want to make sure you have adequate fluid intake to prevent dehydration, which can, further increase their risk of skin breakdown. So talking about preventing skin disorders in the aging population, remember we said that our aging population, they have a decrease in their oil and sweat glands. And so their skin is going to be more dried out. So they don't necessarily need to have a full bath or full shower every single day. You can, kind of clean them, spot clean them, daily. But as far as a full bath or shower, it can be more drying for their skin. So they don't need, need that every single day for a full body or shower. Just kind of, spot cleaning here and there, making sure, they are clean. You don't want to use products with alcohol or, different products that's going to, dry them out. Kind of use like a mild soap. Use mild soap and water to wash them regularly. Of course, if they're incontinent, you want to use soap and water to clean the incontinent, whether it's fecal or urine, to clean them on a regular basis. Use lotions or oils or things like different creams to massage in their skins to help prevent it from drying out, because what's going to happen if their skin is drying out, it's going to crack and possibly cause, open areas in the skin, or maybe it gets itchy and they're scratching, and that can also break open the skin as well. You don't want overexposure to the sun. So you don't want overexposure to the sun. A good amount is good for you, but you don't want overexposure. You don't want to be, exposing the body to different chemicals on a regular basis, or exposing the body to extreme temperatures, extreme cold or things like that either. So skin tears are preventable wounds, some type of traumatic wound, and it is preventable. Three categories of it's the Pain Martin classification system for skin tears. It gives you three types of skin tears. And so with the category 1, it's a skin tear, but there's no tissue loss there. And then with category 2, you have some partial tissue loss. And then category 3, that flap of the skin tear, the epidermal flap, is actually off. It's missing. So remember we said the epidermis is the top layer. So when we talk about that epidermal flap, that's the top layer of the skin. So that's actually missing in a category 3 skin tear. Various things can increase your risk for developing a skin tear easier. So remember we said if the skin is dry, if you're dehydrated, things like that, that can increase your risk of developing a skin tear, because the skin, if it's dried out, it can crack easily or whatnot, and make you more at risk for a skin tear. So that's why we said keeping your patient hydrated to prevent dry skin. Ecchymosis, so that's bruising, friction or shearing or pressure. So when you have shearing, that's when you if you've ever worked in a healthcare facility, say when you're turning a patient and you completely turn that patient on their side, roll the sheets or blankets or whatnot under them, then turn the patient on the other side, and then you can pull the sheet or blanket away from under them. But when you have shearing, instead of just turning that patient side to side to pull that sheet from under them, you just actually take that sheet and pull it against that person's skin, and it causes a skin tear. And so when you have your elderly patients, or people that's dehydrated, they're more at risk for skin breakdowns. Remember, we said our elderly patients, their skin is very fragile, and so doing that can easily cause a skin tear. Or friction might be, if you've ever seen a patient sitting up in a chair, maybe you put them in a chair or something, and then they start to slide down on that backside. They start to slide down out that chair, and then that can cause a skin tear as well. And so, individuals with that fragile skin are more at risk of, skin tears from, say, friction or shearing. And then pressure ulcers are also, the result of pressure, from being in the bed, from being in the chair, whatever it is. And so those type things can, for prolonged periods of time. And so pressure ulcers, depending on the person's status, a healthy young individual with no illnesses, they can probably sit in a chair 30 minutes, an hour, 2 hours, or whatever, and not develop a pressure ulcer. But if you have a fragile old individual sitting in a chair for an hour, 2 hours, or whatever, they and maybe they have poor nutrition, dehydrated, whatever comorbidities, different things going on. They sit in that chair for an hour or two, then they're going to develop a pressure ulcer. So depending on what types of things are going on with a person, they can be more at risk for developing pressure ulcers. A person with impaired sensory perception, so a diabetic patient with neuropathy, if they can't feel, then they're at more at risk for skin tears. Impaired mobility, so they can't, turn and reposition themselves, they're more at risk. A person taking a lot of different medications or steroids. Steroids can put you at risk. Steroids decrease the inflammatory process. So if that inflammatory process is decreased, then you don't see, when an issue might be arising. So all those things can, increase a person's risk for skin tears. These are just some other things that, like we said, comorbidities. So heart failure, stroke, renal disease, diabetes, all those things put a person at higher risk for skin tears as well. Adhesive dressing. So if you have people that you're changing dressings on regularly, so you're taking that tape off, 2-3 times a day, however many times you're changing that dressing, then you got to properly know how to take that tape off, so because you can actually cause a skin tear, pulling that tape off of a patient, especially if they have fragile skin already. You bathing them or dressing them, and you're handling the person rough. I've seen a lot of people, getting skin tears like that, staff, the nursing staff just handling that person rough when they're repositioning them or transferring them, and then they can get a skin tear that way as well. So, of course, you're going to have your wound care orders if you have a patient with a skin tear. So you want to cleanse it, however, whatever the order says to cleanse it with, that's what you're going to cleanse it with. Maybe it's normal saline or whatever it might be. Cleanse it with that. You want, for all of our wounds, we want a moist wound bed. That's going to promote healing, having a moist wound bed. So you don't want your wounds to dry out, but you don't want excessive amounts of drainage. That's what exudate is. So the types of dressing we might choose, it might be something that's going to absorb that excess drainage, because if you've got excess drainage, that can also inhibit the healing. Not only that, that excess exudate or excess drainage, the peri wound, that's the area surrounding the wound, excess drainage can cause that peri wound to macerate and start to break down as well. So you want, when you're choosing your dressings, you're going to choose dressings that are going to absorb that excess drainage as well. But like I said, you want a moist wound bed to promote healing, but you don't want excessive drainage. So there's a difference between those two. So a lot of different things we can put in place to try to, prevent skin tears in patients, whether it's because they're elderly and they're at risk, whether they're immobile, whatever the issue is, if that person has been identified as increased risk for skin tears, you want to put some different measures in place. So, if maybe it's their arms, so they might wear long sleeves or long pants or different things to, try to prevent skin tears. So each person is going to be different in what their measures might be. um, if the person is somebody that can walk around, but maybe they're confused or whatever, so make sure you have lighting, so they don't bump into things, they can see where they're going, if their vision's impaired, well lit. Like we said, making sure they have proper nutrition and hydration, so keeping their nutritional status up, their hydration status up, is going to help promote healthy skin, so that they're not so at risk for skin breakdown or skin tears. Lubricating the skin with creams and lotions. Soaps, so you want soaps that are not, you don't want alcohol based soaps or soaps that's going to dry out the skin, so you want something, a mild soap. And you want to do things that will prevent friction and shearing. So like I said, if if you're rolling the patient to get that sheet from under them, completely roll them, roll that sheet up under the person, then roll the person to the other side, and then you can pull that sheet from under them without snatching or pulling their skin, with the sheet. Friction, to prevent that, like I said, when they're sliding down in that chair, and that's causing friction on that backside. So maybe if they're in a recliner, you can lift the feet of the recliner up to try to so that they don't slide down in that chair, to try to prevent friction. Other measures you can use to prevent skin tears: put padding on the bed rails, put padding in their wheelchairs, so that they can't hit their legs or their arms on the things and cause a skin tear. If their legs or arms are dangling, then make sure you support them so that they can't dangle and accidentally bump into something. That's gonna help prevent skin tears or whatever. If you have to use tape, maybe a paper tape or something, be careful when you're removing that tape. Don't just rip it off their skin and then causing a skin tear in that way. There are several different types of diagnostic tests or procedure that individual might have when they're testing for skin. For example, you might have a skin biopsy. During a skin biopsy, a small piece of tissue from a suspected malignancy or other skin lesion is removed. And so that can be done using one of three techniques. It can be an excision, a shave, or a punch can be used to perform a skin biopsy. When you have an excision biopsy, it removes um, a small lesion in its entirety. And so versus a shave biopsy, it cuts the lesion above the skin line, so leaving the lower, the dermal level, which is the second level. And a punch biopsy, it will remove an oval core from the center of the lesion. So those are just some ways you can biopsy to determine, if the person might have skin cancer or whatnot. You can do a culture and sensitivity. Um, Culture and sensitivity is going to determine, is there some type of bacterial or viral or fungal or whatever infection. Culture is going to tell you if it's present. Sensitivity is going to tell you what type of antibiotic to use, what antibiotic might be helpful to antibiotic or antiviral or antifungal, depending on what the causative agent might be. You might have microscopic tests to determine if there's any fungal, bacterial, viral organisms, and a special light inspection can be used to diagnose certain skin disorders as well. Other diagnostic tests to determine, different skin disorders might be a dioscopy, which uses pressure to determine blanchability, or, changes in skin color to determine if the lesion might be vascular or non-vascular or hemorrhagic. And another one might be a skin patch test. And so the patch test identifies the cause of allergic um, allergic reactions. It's indicated in patients with suspected allergies, or allergies from some type of unknown cause or something. And it uses a sample of common allergens or antigens to determine if one or more of the allergens or antigens will produce some type of positive reaction. So if the doctor suspects a particular causative agent, the doctor may test for a positive reaction to determine, if the person is indeed allergic to something. All right, so when our patients are having different diagnostic tests, um, so when it says ensure a patient has signed informed consent, so the nurse does not actually um, do the informed consent. Whoever the physician or the person that's actually doing the invasive procedure, they are the ones that actually have to do the informed consent. So they have to, when we talk about informed consent, the person has to know, what's going to be done, what's going to be involved in it, what are my alternatives if I do this or if I don't do this, um, or what are my options, is there something else I can, use to treat this situation or whatever. So that's when we talk about informed consent, the physician or the person that's actually doing the invasive procedure obtains the informed consent. But as the nurse, you need to make sure that that has been completed, and that and if it hasn't been completed, then letting the surgeon or whoever's doing it know that that needs to be done. So the nurse is not the person that's going to do it, but they're going to make sure it was done. You're going to reinforce any teaching. The physician or healthcare provider or the RN will be the one that initiates the teaching, but as the LPN, you can reinforce any teaching that's already been done. Check and see if the patient has any allergies. If they're going to be under any anesthesia, do they have any allergies to the anesthesia, any allergies to anything that will be used in the procedure itself. Making sure you're labeling the specimens appropriately, providing any whatever instructions they have post-op, you're putting those, performing those, or implementing those instructions, whether it's a dressing or whatever needs to be done. You're following those instructions. And then just informing the patient about their follow-up care that needs to be done as well. Okay, so you want to make sure you perform a thorough history. When you're talking about a skin assessment, you want to do a thorough history. Um, with skin disorders, you want to expect the patient to report any problems such as changes in their skin appearance, pruritus, which means itching, pain or drainage from lesions. You want to ask various questions that's going to elicit information about the patient's chief complaint. For example, how long have you had this problem? When did it begin? Have you had it before? What does the problem area look like, including its shape, size, color, location, character, distribution? How does the affected area feel? Does anything seem to trigger the problem? Does anything relieve it? Have you had any recent contacts with, detergents, chemicals, plants? Did you recently change soap or skincare products? Have you tried using anything to make the condition feel better? So you want to ask all those different questions to get a thorough understanding of the situation. You want to ask whether the patient has ever had a similar skin condition. Find out if he or she has ever had an allergic reaction to medication, food, or other substances like cosmetics or anything like that. Do they have any past or present allergies that they know about? Find out if they have a history of diabetes, vascular problems, um, immunodeficiency, or any mobility problems as well. So doing a thorough history. You want to do a family history as well, because some disorders such as atopic dermatitis, some of these we'll talk about in the next chapter, like atopic dermatitis, acne, psoriasis, those tend to run in the families. Contagious skin problems might be transmitted by family members, like scabies or something like that. Some allergies might also run in families, so find out about any family members' history of allergies as well. You want to do a social history as well. Obtain relevant information about the patient's lifestyle, including what's their occupation, have they traveled, what's their diet, what's their hobbies, do they smoke, do they drink alcohol, do they use drugs, how often are they exposed to the sun, what's their stress level, what's their sexual contact. You want to do a physical examination as well. You want to do a thorough physical examination. Start out by observing the overall appearance of the patient's skin. This will help you identify areas that need further assessment. Then inspect and palpate the skin one area at a time, focusing on the color, the texture, the turgor, the moisture, the temperature. Be sure to check for and note any skin lesions that the patient might have. So when we're talking about color, do they have ecchymosis? Ecchymosis is bruising. Do they have any cyanosis? Do they have any pallor? So pallor, pale. Get to know these different terms. Cyanosis, are they bluish looking? Erythema, is there any redness? So you want to get to know these different terms as well. Texture and skin turgor. Inspect and palpate the skin's texture. Is it thick? Is it mobile? It should look smooth and be intact. Skin turgor, of course, is going to tell you, about dehydration or whatnot. Like I said, check the patient's skin. Is it moist? The temperature, are they warm or whatnot? All right, so you're gonna run across different types of skin lesions. You got macules, papules, vesicles. So when we talk about macules, those are flat. It's a flat area with altered skin color, um, usually less than 1 centimeter. So that would be like your freckles, your measles, a flat mole, or something like that. Papules are going to be raised, solid area, also generally less than 1 centimeter. So examples of that would be like a wart or an elevated mole or something like that. A vesicle. A vesicle is going to be an elevated lesion, and so it's going to be less than 1 centimeter. So when I say elevated but superficial, might have some serous fluid in there. So an example of that would be like a chicken pox or herpes or shingles, even a second-degree burn. Other types of skin lesions might be like a plaque or wheat. A plaque would be an elevated lesion that's greater than 1 centimeter. So like when we talk about psoriasis, you'll that would be considered a plaque. Wheat, it would be firm edematous, and that might be like insect bite or something like that. Another type of skin lesion would be like a pustule, and so that would be also an elevated lesion, and it's filled with purulent fluid. So purulent means like pus-like fluid. So that would be like your, you'll see that when we talk about acne, would be an example. Impetigo is also another type of pustule. So when you're teaching your patient about various skin disorders, you want to make sure you let them know that if the area is starting to darken or spread, that might be cause for concern, and to notify the physician. If the lesions are increasing in their size, if they're changing shape, if they're becoming red, swollen, the surrounding skin is becoming red or swollen or things like that, or any other noticeable change, they need to, make sure they, notify their physician. You want to teach your patient about their skin disorders, monitor for itching or tenderness or whatnot. Is it oozing? Is it becoming ulcerated? But checking for the ABCDs. So A, is it asymmetrical? B, does it have an irregular border? C, the color of it. D, the diameter of it. Is it getting larger? And so those are some additional things you want to make sure you're teaching your patient to monitor. As the nurse, you always want to do a thorough skin assessment when a patient is admitted to your facility or unit or whatnot. They should have, a thorough skin assessment when being admitted. If you see an area that's red, is it blanching or whatnot, you're going to document the size, the location, the appearance, the characteristics of the lesion. When we measure our lesions, we measure length times width times depth, and we're going to measure in centimeters always. So length times width times depth, and you're going to measure in centimeters. And some facilities, depending on where you are, they might take photographs of pressure ulcers as well to kind of see the progression of it, is it getting better or worse or whatnot. So when we're developing a plan for a patient with skin disorders or trying to prevent skin disorders or whatnot, we're obviously going to, implement plans that's going to, restore skin to normal. So whether it be, if they have an open wound, do we implement dressing changes, based on the doctor's orders or whatnot? We're going to implement or plan to implement things that are going to decrease the patient's pain and itching. We're going to do things that are going to try to prevent infection for our patient. And do things that are, is going to prevent any, further skin damage or whatnot, and try to prevent scarring if at all possible. So different things might be used to prevent or promote healing and prevent spreading of skin disorders. The physician might order medicated baths to help soothe the patient. Medicated baths might consist of like sodium bicarbonate, sodium chloride, cornstarch, oatmeal baths, medicated tars, things like that to help promote soothing or whatnot. These baths will usually last anywhere from about 30 minutes to an hour. And so you don't want the person to get chilled, during that time. When they do get out of the bathtub, you want to dry their skin with a towel by patting their skin dry. You don't want to rub the skin because that increases the risk for skin tears or skin breakdown. So you want to pat the skin dry, and if they need any type of medication applied, go ahead and apply it, right after, so that the skin doesn't have a chance to, get dry and start itching or whatnot. They might also have different laundry requirements to prevent irritants from the detergents to, or the residue to get in their clothes or remain in their clothes um, after they've been washed. And if that residue is on there, it can, cause skin irritation. So if they're at home, they might teach them to use like a tablespoon of vinegar or something like that to ensure that that there's no residue left. Or don't use detergents that have perfume or different additives or things like that as well, because those can be irritating to the skin. Don't use dryer sheets either, because those can contain different chemicals or things like that that can be irritating to the skin. They might also order wet compresses or dressings that can be used uh, to apply to various skin disorders. They might order different topical therapies um, as well to help prevent or promote healing or prevent skin breakdown. So that could include, a variety of different lotions or creams or ointments or gels or different things like that. Now, also in your book on page 988, box 42-3, there's some various guidelines you can look at there for applying different topical medications. For instance, it talks about when applying powders, you want to dry the area thoroughly before applying the powders, because you don't want it to cake up. You don't want that powder to cake up. And if it's wet, it has an increased chance of doing that. You don't want to put the powder on raw areas or whatnot. Ointments, you only want to use a small amount and gently massage it into the skin until it, covers the whole area or whatnot. Um, you want, if it's gels, it gives different types of instruction. If it's a gel, um, so a gel is a semi-solid mixture that tends to liquefy when applied to the skin, and so it could potentially cause some type of burning or stinging if it's applied to a sensitive area. um, So it goes through, so take a look at that, because it, kind of goes through, some other things. For instance, then it talks about all types. You want to always apply topical medication sparingly in a thin film that extends beyond the affected area, about 1/4 of an inch. So take a look at that box on page 988 for guidelines on how to properly apply topical medications.